I'm very honored to talk to such a distinguished group of doctors. I think many of them are my good friends. We have been working together for many, many years. We see patients together. The talk is on tadalafil 5 milligrams benefits beyond erectile function. This is the speaker disclosure slide, which I think most of us are asked to put in the lecture, and there are pros and cons. The problem is, of course, we have to talk about particular drug. And in prostate cancer, we also told to use the drug earlier, the earlier the better, and based on projections, So that's one of the disadvantages of having talks which are sponsored by a trade or a company. And the second problem, of course, we have to subject our slides to wetting a few days before. And on a topic like sexual dysfunction, many of my slides got removed, okay? So if you want all the slides, contact me personally. I'm very encouraged to see on the program that there is a talk tomorrow on male sexual health. I'm very encouraged because sex is more than just erection, right? There's orgasm, there's ejaculation, and then there's fertility, and then of course, I think he's going to talk about hormonal influence on sexual health. I asked my chief pharmacist yesterday to see my usage of tadalafil 5 milligrams, and to my surprise, I've got almost 200 patients taking tadalafil 5 milligrams. So I think I'm quite well suited to talk about this topic. So after the lung and the sensitive kidney, where's the sensitive kidney gone? So I think the penis is also very sensitive. I think very important organ for men, probably the most important organ for men as far as I'm concerned. So I talk about erectile function, defined as the persistent inability to achieve and/or maintain an erection sufficient for satisfactory sexual activity. So I have to elaborate on this satisfactory part, satisfactory sexual activity. In the past, we talked about erectile dysfunction, which defines this as like impotence, mati. Malay say mati pucuk. But I think the penis never die, The penis never mati, unlike the heart or the what is it, other organ, the kidney, which they have to undergo dialysis. So the penis can never die. So how do you talk about penis to a patient? You have to actually be very graphic, right? Very graphic. So you have to say, is the penis hard? Or is the penis hard enough for penetration? And if it is hard enough for penetration, is it completely hard? And of course, whether the penis is perfectly hard and fully rigid. So you have to describe these terms. Actually, of course, I've got a lot of diagrams which got removed from when it's gone through by the sponsor. How long should sexual intercourse last? The study showed that it should last between 7 to 13 minutes, satisfactory sexual intercourse. So it's important that you have erection and have sexual intercourse, either vaginal or oral or rectal, whatever. So it's important that you are able to put the penis into the vagina. So this is called IVLT. Very simple. I don't have too many words, unlike the respiratory and the nephrology lectures. Very simply, okay? Intravaginal lattice time. So that is important for a relationship. Of course, we can talk about foreplay, afterplay, this and that, but it's very important that for satisfactory sexual intercourse, you have a penile erection, you're able to insert the penis into the vagina. Then what about the average sexual intercourse activity per month? Of course, it varies. The quoted incidence is actually, about 2 per month. 3, okay, Malaysia is 3. Of course, there's always one country always better than Malaysia, right? 2.8. And that reminds me of a story that in Norma, we have a lot of patients from CESCO. So they're usually elderly people. So I got this 90-year-old man with an 80-year-old girlfriend. And they're both apparently happily married, like most of us, happily married, apparently. So she asked me, her complaint is, this guy, he wants to have sex every day. You think it's normal or not? I said, it depends. Different people got different habits. Then she turned around and said, doctor, how often do you have sex? So I thought maybe she'd look at me as the standard bearer or what. Of course, I can't answer her. So basic data, how common is ED? Basically, it depends on how you define it, how you define the ED. Whether it's complete, ED or whether it's let me see, yeah. So I also play with the buttons here. So whether it's complete ED or moderate ED, I would think most people have moderate ED at some stage in their life. Some stage in their life. So if you say we talk about complete ED, we talk about complete ED. So this study is done in Asia Pacific, and in Malaysia it's done by a doctor called Dr. Where did he go back? Okay, done by a doctor called Dr. Ismail Tambi. I think a lot of patients do know him. He is a medical officer of the Ministry of, what is that ministry called now? It's LPPKN. I think we got these branches in Kuching, Sibu, Miri, Bintulu. They all got these offices. Mind you, this is government money, government money. And he did a study, and he said there's about 16% of people in Malaysia has complete ED in the Klang Valley, in this age group, 40 to 70. Then we all know about this study. I think the first speakers quote this study, the National Health Mobility Study. They quoted an incidence of 3 in 10. 3 in 10 adult male has erectile dysfunction, have a problem about the erection in bed. And then recently, there's a study published by the CLC, Clinical Research Center. Of course, Kuching got the biggest and the best, CLC, but they didn't study this thing. They only study about the heart only, in Kuching. So this is a study by them, and is led by Dr. Christopher Ho, who is a urologist. He says he's the only trained psychotherapist in Malaysia, the only urologist trained in psychotherapy. And he found that actually, of the sample size, but it's by questionnaire, ask you a question only. So they didn't go to the bedroom and check. So it's 1 in 3 Malaysian men has got erectile dysfunction. So it looks like it's getting worse, getting worse. Time for change. Let's hope they change in Johor Bahru today. Time for change. Okay, when you see a patient with ED or patient complain about ED, you have to examine them. You have to examine them. You do a focus examination. Of course, you have a stethoscope and listen to the heart, listen. But you must also look at the penis. Look at the penis and look at the testes. And if you're inclined in that direction, do a digital rectal examination as well. I know there are some GPs who always do a digital rectal examination, feel the prostate, and of course do a blood profile. But I think most patients in Sarawak now, they tend to do their blood profile already, They have spent $1,000. They have done everything already, including the marker for NPC, marker for God knows what, but they didn't do the testosterone. Because testosterone is very important for erectile function. And I think tomorrow you hear a lot about this testosterone business. So I also look at some of my things. So many years ago, I published that my erectile dysfunction practice in my hospital, and the mean duration of patients having ED is about 20 months. So they waited for a long time, and the age group is 28 to 75, median average of 54. So actually many patients keep their problem for a long time, and they seldom talk to their doctors about the ED. So another recent study shows that most patients will speak up if you ask them. But in Malaysian practice, it's not so easy, Not so easy. Especially the guy who come and see me twice the last 1 week. But every time he comes with his mother, So I know his problem is ED, but how am I going to ask him, about I think they got a problem with fertility. The mother is very worried that he wants the son to have a child, but I know he has ED. So I quietly take the testosterone on my request, and of course his testosterone is very low. So you have to ask them, and sometimes I don't know how to get rid of the mother or the mother-in-law. Sometimes when I examine them, I ask them to go, "Can you please, I want to examine your son or your son-in-law." That's the time when I find a chance to ask them, how is your penis, how is the penis, because usually when we as doctors, when we examine patients, we are supposed to expose them, The Deputy Dean of UNIMAS is here. We ask them to expose from the nipple to the knee. At least we can have a look at the breast and look at the testicle and the penis. So I think you have to examine them, and that's the chance for it. That's the technique of how to get around this erection problem. The other important problem, which I think Mr. Lim has alluded to, and I think Dr. Chan has alluded to, is that the comorbidities. Many of these patients have hypertension, diabetes, psychological problems, and heart problems, and very important, testosterone. So this is a very common situation. So quite commonly, people think that, I go and see a doctor, I've got erectile dysfunction, and then I can get him to fix the problem. You just fix my problem. But usually most patients, when they come and see me, I do a free, almost free, like charge them $10, full urine test, and then I check the blood sugar, and the blood sugar is very high, then it's no point treating them, no point to treat them if the blood sugar is high. My slide got mixed up a bit. Frightened of the slides with the penis. Can you go back to the slide with the comorbidity just now? I want this, let me see. This slide, this one. Yeah, oh, okay, you can play with that one there. No, this one, this slide. Yeah. This one, I want this slide. So we have got a lot of alternative therapy people in Sarawak, right? Reflexology, chiropractor, herbalist. So this Chinese reflexology come and see me. He has got diabetes and his blood sugar is 22. So instead of starting him on some magic drug or to improve his erectile function, I said, you treat the basic thing first. Sort out your blood sugar. Or like, if you've got respiratory problem, sort out your smoking first before you tackle the problem. So I think it's very important we treat the patient as a whole. I'm a urologist. I'm not a sex therapist. I'm not endocrinologist. So I like to sideline a bit from my main lecture. So if you talk about sex, and we always operate on the prostate. So if a patient has got a prostate problem and remove the prostate, can the patient still have an erection? Can the patient have ejaculation? Can the patient have orgasm? So if you look at the physiology of this process, the answer is yes. When you remove the prostate, there's no more fluid, right? There's no semen. So he cannot ejaculate fluid, but he can still have an orgasm. So you don't have to have an erection to have an orgasm. So you can sit there and look at the blue movie and you can still have an orgasm. So these are independent events. So when you treat patients, you have to see what is their problem. Then you can treat it. And it doesn't mean that you don't have an erection, you can have sexual activity. Of course, the pathway must be intact, right from the brain, spinal cord, pelvis, pelvic tumor, prostate cancer. All this must be intact. And of course, we must have testosterone. So there's a picture here, the nice picture here, they have gone missing. So actually, erection is a vascular event. Just like the heart. So except that the penis is more important. And also just like the glomerulus, there's a blood flow. So the blood flow to the penis, we want it as high as possible. Whereas in the kidney, we want it as low as possible. There's no bone in the penis. So again, there's a gap here. There's some missing photograph there. So now we come to the drug. Come to the medication, tadalafil. I think many of you are very familiar with sildenafil. Sildenafil 50, 100, they call Viagra. So it came and it revolutionized the idea about sexual activity. So now we have tadalafil, 20 milligrams. It has been available for quite a long time. And then we have tadalafil 5 milligrams. So that's the focus of today's talk, 5 milligrams. And when you compare the two, the effect on sexual function, erection is almost the same. 40 plus, 50 plus %. The difference is that tadalafil 5 milligrams is you take every day, 5 milligrams. The other 20 milligrams you take on demand. The problem is, how do you know when you're going to have sex? That's the problem. So if you take the tablet and you have to wait for 1 hour or 2 hours, the men usually don't know what to do. Like maybe nowadays we can. And now we look at the handphone and look at all the WhatsApp messages. I got a few hundred I haven't read. And of course the woman can read some book, some Enid Blyton or some book like that, okay? But whereas you take once a day, you are ready forever. So I look at that data very briefly because I keep all my patients' records on my laptop according to the disease process. So the ED folder, I look at it. The age group of the patients who come and see me and who are taking tadalafil is 43 to 86 with a median age of 52, mean age of 62. So they're quite youngish people, younger than us. So there is a big spectrum of patients who can take tadalafil. From a practical point of view, if the patient is a VVIP or VIP, it doesn't matter because we can just dispense it and give to the patient. For corporate patients, that means Shell, Petronas, insurance patients, if your diagnosis is BPH, you can give it to the patient. Of course, we know that we're giving them both for BPH as well as erectile dysfunction. But erectile dysfunction, the corporate will not pay. Another obsession by a lot of men and women is the size of the penis. So they come and see me, oh, can you give me something or do an operation for me to increase the size of the penis? Unfortunately, in Malaysia, I don't have anybody who will do that. I think there may be somebody in Brisbane, somebody in Taiwan, and maybe somebody in Thailand. So for my personal sort of experience with patients, that if you take tadalafil 5 milligrams, it will increase the blood flow to the penis, and that will increase the size of the penis. Of course, many patients actually, they go and have some kind of injection silicone or fat or something, but to increase the size of the penis. But personally, I think really the size of the penis doesn't really matter. So for patients who want to increase the girth and the length of the penis, you can give them tadalafil 5 milligrams. Of course, it also depends. There's a lot of variation in the size of the penis. You know, the erect penis, the flaccid penis. So the flaccid penis, if you measure it about 3.5, that is adequate, more than adequate. So for patients who complain about this, I take the ruler out, lie them down, measure it, and show them that actually your penis is within the range of your age and your body size. Another big problem, of course, is the intake of this product with food. So for Viagra or sildenafil, if you take it with food, the level is much lower. You take it with food. So you preferably take an empty stomach. But tadalafil, you can take it with and without food. And of course, sex is something to do with the mood, the food, the wine, the alcohol. So food is quite an important component. So there's a big advantage of tadalafil. You can take it with food. What about side effects? Patients are very worried about side effects, quite understandably so. This is a good study, and we also in Kuching we're also part of the study on tadalafil, part of the Asia Pacific study. And you look at the side effects between placebo and Cialis or tadalafil 5 milligrams, they're almost the same. So virtually, you don't have much side effects, and virtually you can put it into the Sarawak water, okay? Okay? But there are side effects. There are significant side effects. It lowers the blood pressure if it's taken together with a nitrate. But now there's not so many patients that are taking nitrates. If they're taking nitrates, then they have to be admitted probably for a few days in the intensive care or high dependency unit to monitor the blood pressure. Maybe have to give them extra intravenous fluids. Otherwise, there are very few side effects. Of course, the other side effect is the cost. Cost is very, very important now. So much so that when I went to UK recently for update and also to see my children, I see this advertisement outside the pharmacy. You can just buy it over the counter. But of course, a pharmacist will give it to you. A pharmacist will give it to you, and they may ask you a few questions. I didn't try to buy, but I know that they will ask you a few questions, especially like your blood pressure, or are you taking other medications? Okay, actually, the most important benefit for tadalafil is for sexual function, but it's also for BPH. And we know that BPH, or benign prostatic hyperplasia, or LUTS, LUTS, lower urinary tract symptoms, they are in the similar age group. And you give tadalafil to patients who are having problem passing urine, and you follow them up, you'll find that they improve in symptom score very well. So that's why they called it, this is one treatment for two problems. So for patients who are corporate patients, Petronas, Shell, Sesco, you can give them tadalafil, and the diagnosis, you put BPH. It will be approved. How does it work? Why does it work? The theory is like this, that the prostate, the penis, the bladder neck area, the receptors, the smooth muscle are very similar. The same isoenzymes. and therefore you give this medication, it should work. But let me tell you this, I'm almost 70, so a lot of these ideas about drugs, about how they work, actually are just theories, they are ideas. So there's a very prominent Malaysian urologist in Singapore GH. So he stood up at a meeting and said, no, don't tell us all this bullshit. He said, the penis is longer after you take the tadalafil. So therefore, the patient has a perception that they can pass urine better. Okay? So I think his explanation applies to many of the drugs that people try to talk to you about, this theory, that theory. So in terms of guidelines, the companies always like to quote the guidelines. So the European Urology Association guidelines, which team up with the Malaysian Urology Association, and there is a strong recommendation that you can use phosphodiesterase type 5 inhibitor, which is sildenafil, tadalafil, udanafil, all this, vardenafil, all this. They don't specify which one, but actually in the FDA, in the Malaysian DCA, tadalafil 5 mg is the only one that is recommended for the usage for treatment of LUTs. Okay, so that is the background to this. Of course, you can also buy sildenafil and cut into 4 or cut into 5 or whatever. I think it can be used, I think, because there's a cost concern, right? This is one of the latest papers just published last year on the benefits of PDE5 inhibitors, namely tadalafil and sildenafil, on other health benefits. And they found that tadalafil, sildenafil reduces myocardial infarction, reduces stroke, reduces all-cause mortality, and also reduces venous thromboembolism, reduces dementia. More reasons to put in Sarawak water, okay? And you should study early. This idea of starting, same thing with prostate cancer, they want you to start early. So what are the mechanisms? Again, these are postulates. Postulates, they increase the blood flow, increase the smooth muscle relaxation, and increase and improve sexual activity, and they say sex is good for health. So, and then the other mechanism of how it affects the heart. No cardiologists here, right? I don't know whether they agree. I'm sure they won't agree with me. They won't agree with this study. Okay, enhance the endothelial function, nitric oxide, the same molecule, the same magic molecule they mentioned, increase blood flow. And why is it that the tadalafil is better than sildenafil? Basically, it's the duration of action. So if you take tadalafil, it lasts longer. So when tadalafil first came out, they said this is the weekend Viagra. You take it on Friday, you have sex on Friday night, Saturday, Sunday, and even Monday morning. Whereas the duration of action of sildenafil is shorter. So I'm coming to my second last slide already. And just like Dr. Chan, I said that actually in men's health, it's very, very important to emphasize on other factors. Okay, you'll be pleased to see that even I'm a urologist, I'm a surgeon. The smoking is very important. Exercise, body weight, your diet. So all this is part of the management of any condition, I think. And actually the medication is only one aspect of the treatment of sexual dysfunction. There's so many other treatments, sexual treatment, like surgical treatment, injection into the penis. So actually every man can have an erection and the penis should never die. Thank you, Mr. Chairman.